Well, we're approaching the end of February, and some of my patients are already struggling with the New Year's resolutions, especially that one to lose weight. The first thing I want to tell them is don't despair. The scale might be lying to them, or at least not telling them the full truth. Now, for a physician, that might seem like a wild statement, but in this video, I'm going to explain why the number of pounds you weigh, or BMI, is just not the most important number to measure in terms of your health or even appearance, and how a really simple tool like this can point you in the right direction. Body mass index, abbreviated as BMI, came out of the life insurance industry over 100 years ago. It was never intended to be the most important metric in terms of judging a person as healthy or not. But unfortunately, in recent decades, it seems to be the case. Of course, any individual's health is just much more nuanced than that. And I would even argue the way that they look cannot be entirely captured by just a BMI. So, although at extremes it might mean something, when we look deeper, it's just much more complicated. So let me go over to the blackboard and explain why. In medical school, we learn about the various organs and tissues that make up the human body. However, I think we kind of lose track of that when we're talking about a person's weight. When someone says they are overweight or wanting to lose weight, it's kind of this vague statement. And sometimes I make a joke, well, let's just cut one of your legs off. That'll make your BMI lower. And they kind of scratch their head. But the reason I say that is because I think we need to be precise about what our goal is here. What our goal is to lose fat tissue, and I have this really gross model of fat here that represents 5 pounds of fat tissue and approximately the volume it would take up in our body. I think that's important that we recognize that our goal is fat loss or not having too much fat, and that all these other tissues we have, especially muscle and bone, are something that is healthy for us and something we want to maintain. And if we go about this in the wrong way, that scale can be very misleading or perhaps even harmful. So in our practice, we measure something called body composition. And all that is looking at a person's weight within each of those tissues. So yellow here is fat, pink or red represents muscle, and those are the two largest tissues in terms of mass in the human body. Bones would be the third, and then the rest of the stuff like connective tissue and organs make up about 20% or so. So once a person reaches full adult height, really the only two tissues that are in major flux in terms of gaining or losing would be fat and muscle. And we'll save the skeleton and osteoporosis talk for another day. And again, the scale can't tell us which it is. I'm going to give some examples here that are drawn from real-world patients, and I'm going to standardize it by height just to make the numbers kind of make sense to people. So I'm going to say that this person, or all these people, is 68 inches tall or 5'8", and I'm going to start at 204 pounds. At that weight, that would give them a BMI of 31. Now, by the BMI scale or categories, this would be obese because anything over 30 is considered such. But if I look deeper at them in terms of their body composition, I may find that their body fat is about 35% of their weight, their muscles make up about 45%, and then the remainder of the tissues. For people who don't have a perspective about what is a normal or healthy amount of body fat, I would just say that this is too much, but not an extreme amount, not super high, at least based upon modern American standards. So yes, I would probably counsel this patient that they do need to lose some fat tissue, but they need to do it in a smart way, preserving as much of this as possible. But let's say I had another person come in, also the same height, and I weighed them at 204, of course gives me the same BMI, and I did a body composition test on them, and they were significantly less as a percentage fat and more muscle. So they had 10% less fat and 10% more muscle. Now, if I investigated further with lab testing, blood pressure, health history, looking at their chronic conditions, I am much more likely to find that person A, the first person with a higher percent fat, has these type of problems, especially if they're older, when I compare them to person B. Now, person B may not be totally happy with their physique or how they look, but in terms of skeletal muscle, they have a great amount, a really high amount in fact. So this person, in terms of health, is in a much better position. When we're comparing two people to each other, I think that makes sense to people that even though they weigh the same, they may not be made of the same stuff and may not have the same health picture overall. And they may look different. And I've seen videos and pictures online of people at the same weight after they get more lean, looking way different. And people would judge one of them as lighter than the other when in fact their weight didn't change at all. But I think it gets much more tricky for people when they think about themselves, either in the past or in the future, as a goal. For whatever reason, people get fixated on losing a certain number of pounds or getting back to a certain body weight. And I guess that makes sense, but I have to remind people, but just because they go back to 178 pounds that they weighed 10 years ago, they may not look the same, feel the same, or be just as healthy as they were then, because it doesn't guarantee their body composition will be the same. I'm going to give some examples here of a person losing weight and the way to do it that is healthiest, but I'm first going to give you a cautionary tale in losing weight in the wrong way. So let's say this person started at 204 pounds and they really buckled down on their diet. They weren't eating very much. They probably felt bad and weren't moving very much. So several months later, they got down to 178 pounds, which would put their BMI at 27. Now they would be categorized as only overweight. And in fact, their doctor might congratulate them and say, keep up the good work, keep at it. Unfortunately, if I did a body composition test on them, we may find that actually they didn't lose that much body fat. In fact, if we compare as a percentage, their percent body fat went up. And you might say, well, where the heck did all that come from? Well, unfortunately, in this case, it came from muscle. And this is a very plausible scenario. Unlikely to lose 100% muscle, but we have actually measured patients who have lost significantly more muscle than they realized. And so out of 10 pounds, they may have lost 7 muscle and 3 fat. And obviously that's a bad thing. And you might say, well, I don't really care. I don't really want too much muscle. I'm not trying to look muscular. I'm not trying to be buff or be a bodybuilder. But this muscle mass is super important for many reasons. Number one is pretty obvious. It's the foundation of our strength. If we don't have enough muscle, we can't move about the world and do things like walk upstairs. And I know some people say, well, I have enough. I can still move around and I don't really care about that. But as we get older, this becomes increasingly important. So if you can think about yourself 30 years in the future or at age 70 or 80, I promise you're going to want every ounce of muscle at that age. Number two, in the short term, this muscle mass has a huge effect on our metabolism in terms of what our overall metabolic rate is, but also in things like regulating our blood sugar. So I know a lot of people say, I'm getting older and my metabolism is slowing down and I can't eat like I used to. And man, it seems like no matter what I eat, I gain weight. And I used to kind of scoff at people who said they had a quote slow metabolism, but we actually can measure that and we do in our clinic. And there is truth to that. And it is mostly explained by people who have low muscle mass. So even if a person weighs the same as they did 20 years ago, if they have significantly less muscle, their furnace is just going to burn less hot. They're not going to burn as many calories or as much energy at rest. And this matters a lot, that muscle mass is really all of it, at least through age 60 or 70. It's not inherent to just getting older. That's going to be really important for their weight management long term. So if you lose muscle in this process, your metabolism goes down, and then it's even harder to maintain your weight moving forward. And I think this is part of the effect of people losing weight and then regaining it. And if you repeat that cycle enough, you end up sometimes losing enough muscle that it becomes very challenging. So that's the bad way to go about it. But let's say this person, starting at 204, took my advice and took the smart approach and was eating a healthy amount of protein, was doing some strength training, and man, they look great. Now, this wouldn't happen over a short period of time, but they have 20% body fat, which isn't super lean, but starting at 35, they will look radically different and feel better. And they gained a ton of muscle. This would be judged as an extremely strong looking, fit person. Although again, the BMI still says they're overweight. This would be the classic example of like someone who looks really athletic, but the BMI says they're overweight. So obviously this is our goal. But I think what's more interesting is in people who are attempting to lose weight, but not doing it and getting very discouraged. So let's say this person started at 204 and they were doing everything right, but they step on the scale after a few months and they just haven't lost any weight. They still weigh 204. They're still, quote, obese. However, it's very possible that their body composition is changing for the better. So let's say this person gained a significant amount of muscle, that's again pounds, and they lost fat at the same time. We would call this recomposition, which is quite difficult to do, not impossible at this starting point, but effectively they gained as much muscle as fat lost, and so the scale doesn't say anything is different. But I promise you this person, just like when we compared person A to B, is in a much better position, is much healthier. And really, the thing I fear the most with this long term, when people have aggressive weight loss efforts, including if you're using GLP-1 medications, is that if we repeat this cycle and we lose too much muscle in the process, eventually we end up kind of at this so-called skinny fat level where, yeah, our weight is now normal. So if this person weighed 158, yay, their BMI is now 24. You're now normal body weight. Congratulations, you're no longer overweight or obese. But sadly, this person is very, very soft. They're made out of a lot of fat tissue. 60% fat might seem almost impossible to a person to conceptualize, but sadly, it is not that uncommon to see people as they get older get up to 50 or 60% body fat and no more than 20 or 30% muscle. So this person, although they might be thin and they might be relatively light, is definitely not healthy. In fact, this person is probably as likely as any of these people to have things like type 2 diabetes and metabolic syndrome. So I hope that makes sense to you in terms of compartmentalizing and understanding what tissues we're wanting to lose. But I know not everyone has access to body composition testing. It's not that expensive, but I know some people, it might be out of their reach. So you might say, what can I focus on instead of the scale to make sure that I'm losing body fat? And what's really awesome is we can get this simple tool called a tape measure. Now, this is one designed to measure abdominal circumference, which is what we're going to be focusing on. But any cloth or flexible tape measure will do. And the reason that we want to measure our waist or our abdomen is because of the anatomy here. So I drew a little diagram of this, and this would be the belly button. So perhaps I should turn the other way here, like this. So if you cut me in half down the middle and turn me to the side, that's what we're looking at right here. Looking at a cross section and the layers of our abdomen, starting from the outside on the front, we have some fat. Everyone has subcutaneous fat. Then we have a thin layer of abdominal muscles. You know, these might be the six-pack muscles or your other core muscles. Then we have our internal organs here, intestines, liver, etc. And then we have some back muscles and then a little bit of fat on the outside. So if you look at these abdominal muscles, I don't care how strong you are, how fit you are, how many crunches or setups you do, you just can't get these muscles very big or thick. We're talking about centimeters instead of inches. So effectively, if we measure the distance around, so if we are measuring our abdomen around the widest part, and for most people that's around their belly button, and that includes, yes, the love handles, the beer belly, all that stuff. What we would find is we're a certain number of inches around, and every extra inch around has to be fat tissue. Because again, the musculature just can't change that much. But there's two types of fat here. There's the subcutaneous fat, the stuff on the outside, and then the more dangerous type of fat is what we call visceral fat. Viscera just means organs. So the fat that is around our liver and around our intestines is much more strongly associated with poor health than even the extra tissue that we worry about on the outside. So if we compare waist to the scale, to weight, this in terms of prediction of a person's health is far better. There's decades of studies proving this. And sadly, we haven't incorporated this measurement into standards of care for medicine. You might ask, well, what should mine be? We should standardize this for a person's height. And so our goal for general health is less than 50%. Now, being right at 50% or below that, is that going to give a person a physique that is shredded or a beach body or what they want? Maybe not. But from an overall health risk standpoint, we're pretty happy if a person's less than 50% of their height. So you take the number of inches they are tall. So this person, example, 68 inches. If they were 34 inches or less, I would say, hey, that's a pretty good ratio. Your risk is relatively low. Now, if they're over 60%, or 41 inches in this case, that is really bad. That is an extremely high risk of things like type 2 diabetes, heart disease, cancer, early death. I mean, you name it, it's not good. And if a person's in between 50 and 60%, I would say they have a moderate risk. So what would that look like in these patients who I gave examples? I'm going to go back and kind of plug the numbers in here to these examples we gave. So if this person with this body composition measured their abdomen, what we'd probably find is it's about 42, which on that scale would be really bad, right? This other person who weighed the exact same amounts because they're leaner had a waist circumference of only 36, putting them slightly high, but not that bad. But if we looked at the person who weighed 178 pounds, but went about it in the wrong way, yeah, again, they're lighter, but their waist circumference only went down an inch. And so if I was counseling this person, I would not celebrate their weight loss. I would say, yeah, but your waist only went down 1 inch. So if you lost 30 pounds and you only lost 1 inch, what it probably means is that you're losing more muscle than fat. And the one I gave the gold star here too. So the person that lost a lot of weight and gained a lot of muscle, we'd probably find that their waist circumference is now relatively small at 33 inches and definitely in the good category. And then again, the skinny fat person would be pear-shaped, frankly. And even though they only weigh 158 pounds and have a good BMI, they would be 40 inches around, which is not that much different than where they started. So I hope this makes sense to everyone, and I hope this helps them focus on something and not fret about the scale. If you're interested in this type of service or perspective, we offer prevention and longevity services to anyone, but we also heavily incorporate this into our standard primary care. If you'd like to learn more, we have a website with a bunch of information offering body composition testing, some advanced testing on metabolic conditions, and just for people who are looking to get healthier and fitter in 2026.